please.
Chair Novak,
Here.
Vice Chair Brown,
Here.
Oscar Delgado is absent, Christopher Dare. Here. Dr. Rika Danko is absent, Marsha Burkhisser.
Here.
Tom Young,
Here.
we have a quorum.
Good, thank you very much. Mr. Young, will you lead us in the pledge, please?
Absolutely. I pledge allegiance to the flag
Of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Oh, good, we're on. One technical timeout. Okay, I need any public comment that's at this point?
Not at this time, sir.
Good, thank you very much. Item number 4, approval of the agenda. If everybody's had a chance to look through it, I need a motion to.
I move we approve
What's
it.
that?
Second.
Second. Mr. Dare, Councilman Dare, all in favor?
Aye.
Opposed? Approved, move on. Mr. Health Officer, you're on.
Thank you, Mr. Chair. Next, we have recognitions on the agenda, and I'd like to begin with years of service. And our first recipient, Elizabeth Muniz, is got 5 years of service, but regretfully, she is hard at work in our clinic right now, so she couldn't make it to the meeting. We have a couple of other years of service. We have Jeff Brazel with 25 years of service, but I don't see Jeff here. So, but congratulations to Mr. Brazel on his service. He's currently a senior registered environmental health specialist in EHS. And then we also have Mike Azell, who has 25 years of service, another senior in EHS, and I believe all of our staff are busy working today. So congratulations to them. That's a combined 55 years of service across those 3 employees. And then we do have Ms. Amber English with us today. And Amber, if you could please stand up. I want to congratulate Amber on her promotion from senior environmental specialist to an environmental health specialist supervisor in EHS. So well-deserved.
Thank you.
Congratulations, Ms. English. We have several new hires with us today, and I'd like to ask Dr. Todd if he could introduce Raquel Dupuy Grafton to us today.
Members of the board, it's my pleasure to introduce Raquel Dupuy Grafton, who is the new program coordinator with Public Health Preparedness Program. Raquel has a master's degree in internal relations and comes to our program by way of the university system. She will be working on several different initiatives within the program to include mass care, volunteer management, and first responder safety and health. And I just learned as we were walking down here that she hails from my hometown in Fresno, California. And I think we told me you went to Fresno State University. Yes. And so anyway, we are pleased to have her on the staff and working with us.
Good. Thank you. Welcome aboard.
All right. Next, I'd like to ask Ms. Lotritz if she could please introduce Megan Bowling, who's the new medical billing specialist with CCHS.
Yay.
Hi, Lisa Lotritz, Division Director for CCHS, for the record. Megan comes to us from Carson Medical Group with experience in medical billing. She has a wonderful, positive outlook, and I enjoy seeing her smiling face every day as I sit close to her. So we're very happy to have Megan join us.
Good.
Congratulations. And Ms. Lotritz, if you could stay there and introduce Wendy Altmaier as well. And Wendy is new public health nurse with the Health District.
So Wendy is a new public health nurse in our immunization program. She has 10 years of nursing experience. She previously worked at Renown as an infection preventionist, and she also has experience as an RN case manager. She has her diverse background in nursing. I think it's going to be very beneficial for our programs. We're excited to have her join us.
Terrific, thank you.
Congratulations. And if we could have everybody stick around, we've got our consent agenda, and then we've got some proclamation and resolution. We'll do some pictures for everybody, so please stand by for that.
After reviewing our agenda that was mailed out, do we have anything pulled off the consent agenda at this point?
I move to approve the consent agenda as is.
Thank you.
I'll second that.
Seconded by Chief Brown. All in favor?
Aye.
Opposed? Carried. Picture time.
Well, let's,
You up?
if we could move on, we've got a...
Oh, you've got something else.
We've
Okay.
got, the next item is our International Overdose Awareness Day proclamation. And if I could ask for Jennifer Dillette Snyder to come up, and Lisa Lotritz, perhaps if you can introduce Jennifer while I'm coming down there to read the proclamation. That would be perfect.
Hi.
I'll be right with you.
So Jennifer Dillette Snyder is the Executive Director of Join Together Northern Nevada, a nonprofit substance abuse prevention coalition. She has worked in the prevention field for the past 15 years. She currently serves as a member of the Washoe Regional Behavioral Health Policy Board and several other state boards. I would like to take the opportunity to express CCHS appreciation for our ongoing partnership with Join Together Northern Nevada.
All right. Thank you, Lisa. And please stay here. And I echo our appreciation for your efforts. So this is our proclamation for International Overdose Awareness Day. Whereas International Overdose Awareness Day is recognized around the world as a day to acknowledge individual loss and family grief for people who have suffered an overdose, and whereas in 2018 there were 170 drug overdose deaths in Washoe County, 741 in Nevada, and 67,744 in the United States. And whereas Overdose Awareness Day recognizes overdoses from legal and illicit drugs because it echoes the tragedy of the overdose crisis, allowing us to speak and educate more about the issue. And whereas Overdose Awareness Day raises awareness of and reduces the stigma of drug-related deaths and is an opportunity to honor those who lost their loved ones to an overdose. And whereas Overdose Awareness Day celebrates those who have survived an overdose. And whereas Overdose Awareness Day sends a strong message to support those suffering from a substance use disorder to acknowledge they are loved and valued. And whereas Overdose Awareness Day will bring attention to the struggle of addiction in our community while making a commitment to preventing loss of life, now, therefore, be it resolved that the Washoe County District Board of Health does hereby proclaim August 31st, 2019 as International Overdose Awareness Day in Washoe County, Nevada, adopted this 22nd day of August, 2019. So, I believe we need to have a vote
Yes,
for-
yes, do. We need to approve a proclamation for them, so. A motion? Second, okay. Second, but, all in favor?
Aye.
You're proclaimed.
All right, congratulations. Here's the proclamation. Thank you for coming. All right, and please stick around for pictures. Our next
one.
item is a resolution. It's the Vision Zero Truckee Meadows Action Plan in support of a goal to eliminate pedestrian deaths. And I'd like to ask Ms. Lotritz also to come back up and to introduce our RTC representative.
Okay, Rebecca Capular is the senior planner for RTC, and she's here today, it's very short, to discuss the Vision Zero Truckee Meadows Task Force. So she's going to have a PowerPoint presentation for us.
Let me, how about if I read the resolution
That would be
first?
great.
Okay. So the resolution is, whereas over the past 10 years, 327 people have died while walking, biking, or driving on Washoe County roadways. And whereas between 2012 and 2017, 28% of the fatalities in Washoe County were pedestrians. And whereas traffic deaths and serious injuries in the United States have disproportionately impacted low-income households, older adults and youth, people with disabilities, people of color, and households with limited vehicle access. And whereas Vision Zero Truckee Meadows provides a framework for reducing traffic deaths and serious injuries through a comprehensive and data-driven approach. Whereas on October 2017, the region initiated its commitment for a greater culture of safety and formed a Vision Zero partnership through the Vision Zero Truckee Meadows Task Force. And whereas the Vision Zero Truckee Meadows Task Force implemented a pedestrian safety campaign in 2019 to engage the local community and partners with meaningful outreach and messaging and activate everyone to take ownership and participate in saving lives on our roadways through the Don't Kill a Dream awareness campaign. And whereas the Vision Zero Truckee Meadows has completed an action plan with the support of local leaders, city, county, state, and federal agencies, community stakeholders, the public and private sector to identify solutions for the Truckee Meadows to make equitable, data-driven decisions to improve safety throughout our community. Now, therefore, be it resolved that the Washoe County District Board of Health does hereby adopt and endorse the Vision Zero Action Plan and the goal to eliminate pedestrian deaths in Washoe County by the year 2030, adopted this 22nd day of August, 2019.
Thank you, nicely done.
Okay. And would the board like the presentation now?
Sure.
Okay.
Please.
Thank you. Good afternoon. I'm Rebecca Capular with RTC, and I want to thank the board for inviting Vision Zero to be here today. I'll figure out this little clicker here in a minute. Try now. Okay, there we go. Thank you. As you can see, even though I'm RTC, RTC does not make up the Vision Zero Task Force. There's over 15 active agencies involved, and it takes all of us together to work and do this. Our newest partners have been Washoe County Sheriff and Safe Kids Coalition, as well as Renown Hospital. One component the Renown Hospital brings that's really valuable to us is their trauma center is involved. So when we talk about fatalities, we talk about, how to reduce that, but there's also serious crashes, serious injuries, and the cost and how those affect people's lives. So they bring a new component of the health, as well as the health district and air quality has been really instrumental in our partnership as well. We've been meeting since about 2017, and what we did was identified 4 focus areas. One was downtown Sparks, Midtown, the University, and West 4th Street. And in the last 2 years, we collected data on all of those areas and really tried to look at what kind of components are happening with pedestrian crashes. We looked at time of day, the age of the pedestrian, was there impairment for either the driver or the pedestrian, lighting conditions, all sorts of stuff. And we have all of this data on our website, so you can easily go and look at it at visionzerotruckeemeadows.com. In addition to collecting that data, we decided, okay, we're seeing what's happening in these areas, but we really need to go talk to pedestrians. In November of last year, we went boots on the ground and talked to over 550 pedestrians one-on-one in each of our 4 focus areas. It was one of the best weeks I've ever had because I learned a lot, and even though it was cold, I was really jazzed and enthusiastic to really kind of talk to people and hear from them firsthand what they were encountering. Along with that, we did an online survey with the same questions, and we received over 1,000 responses, so we had over 1,500 responses altogether. And with that and the other data we had, we decided we were going to put together a Vision Zero action plan, which you received in your packet, and it's also on our website. There's really 3 components in our action plan, and it's not anything that one agency is going to do. It's really a regional task force where we're going to look at how we're going to grow our task force. We have information on street and infrastructure, which really plays a part with all the jurisdictions being RTC, Reno, Sparks, Washoe County. And then we also have a large community engagement. We know that we need to get the community involved because it takes all of us to reach the goal of 0 fatalities by 2030. So when people ask us, is that a realistic goal? Can you really reach 0 fatalities? Well, my answer is that's the goal in my house, and I would like to hope it's the goal in your house as well, and all of our houses. Therefore, we have a shared responsibility when we're doing any type of transportation, whether we're on a bicycle or walking or driving a car. In the years 2013 through 17, this infographic shows you that of all of the cars that were involved in crashes, 2% of those were either fatalities or serious injury crashes. Of all of the bicycle crashes that were reported in that same 5-year period, 10% were either fatality or serious injury crashes, and we want to prevent all of those. And here you can see pedestrian was the highest vulnerable group, with 24% being either fatalities or serious crashes, and the reason serious injury crashes. And the reason that this is important to us is because sometimes we've had questions like, well, you are focusing on pedestrians, but what about other road users? Our thought process with that is if you make the road safest for the most vulnerable user, which is the pedestrian, in turn you will make the road safer for all users. And it kind of goes hand in hand there. So in short, we have been going to a lot of different boards and commissions. As you can see, we've been very busy, and I appreciate your time today and your your resolution. It really helps us to see that we have support from your leadership. And moving forward, we are going to be asking to become the first Vision Zero community in the state of Nevada. As you can see, there aren't any. It's a national program. We're getting ready to submit our application in September, and I know they're going to love what we've done because we've done a lot of hard work. And we're hoping to announce that in October at the Sparks Nugget. There's a 2019 Safety Summit, which is free, and you will all be invited to a press conference we'll be doing there and highlighting safety with all of our partners and the public. So with that, I'm happy to answer any questions that you might have, and I want to thank you again for your time today.
Any questions? Yes, sir.
I just have one, just out of curiosity, where you said you, came up with lots of different ideas and things about this incident, and then you went out and talked to the 500 people on a cold day in November. But what new things did you learn from talking to people that you didn't anticipate and that might help us with curbing this
That's a
issue?
great question, and I can tell you off the top of my head, one of the things I walked away with was a question we asked the pedestrians was, when you're at an intersection at night, do you feel that you are safe and crossing at a safe crossing? And overwhelmingly 70-something% said absolutely. But the online surveys with that same question, they said they do not feel that drivers can see pedestrians at night at intersections, and they don't feel it's safe. So what I walked away with was pedestrians are saying, I'm at this intersection, there's lighting, people can see me, I'm doing the right thing, but the drivers behind the car are driving and they can't see the pedestrians, so I think we have a real large disconnect. Therefore, in our action plan, we have a regional study to do a lighting study and look at it not just in one jurisdiction, but all the jurisdictions, and see what kind of needs are going on with our lighting. As you, I'm a dinosaur, I've been doing this for over 20 years, and 20 years ago, lighting was a lot different. We have a lot of great new LED and technology now, so we can pull that together and really look and see if we're using the best technology out there. So that was one example. I have several, though.
Well, yeah, well, it's fun to keep expanding that.
Yeah, well, thank you for asking.
Good. I will entertain a motion to support the resolution.
Move to support.
Okay, second, Chief Brown. All in favor?
Aye.
Aye. You are supporting your resolution. Thank you
so
for
much.
coming. Congratulations, and there you are, and so I think it's picture time.
Picture time.
And just so you know, we will scan this and be putting it on our website with the other resolutions, so thank you again.
Good. You can check the box on your slide.
Yeah, we will.
Well, let's start with.
Okay, and there's a few of us.
rough center. Okay, how's that? There, much better. Okay, I got you. All right, ready, set, go. And one more, ready, set, go. Okay, very nice.
Good job. Thank you. Jennifer. And Nicole and son-in-law from our state. She said great.
One, two, three. And one more. Two, three. There we go.
And the commemorative walk is Thursday. All right. Raquel, come on down.
You're the next contestant, Bob Parker.
Just a little bit now. Okay, ready, set, go. One more. There we go. Thank you. Thank you. Thank you. Ready, set, go. And one more. Ready, set, go. There you go. Thank you very much.
No, and Megan, not one.
Hi Megan, I'm Laura.
She's a billing person. After private practice, we love her.
Okay. Ready, set, go. One more. Ready, set, go. There you go. Thank you.
Congratulations. Thank you.
Ready, go. And one more. Ready, set, go. There you are. Thank you so much.
Good.
Is that everybody? Thank you.
It's tough. I mean, you go to eat restaurants, find violations.
Sure. Like,
But 6 hours, man. Get right over the coals.
All the introductions in like 3 minutes. Jeez.
Hi.
I mean, call me up, but I'll just be here.
Oh, that's right. Call you up, okay. Item, yeah. She wants it right. Okay.
There's one in every group.
Okay, item number 9, Regional Medical Services Advisory Board. Our summary will be given by Ms. Conte. Go right ahead.
Good afternoon. Just a few things. What you will see in the packet is the fiscal year 18 annual report. The fiscal year 19 is on track. That will be heard by the EMS Advisory Board at their November meeting. So this is a full year behind. But I wanted to bring that to your attention that the next meeting summary, you will have the newest data. I'm available to answer any questions that you might have. I just want to point out on the CAD to CAD interface update, I know that's been
An issue.
well, and of interest to the board. The discussions that have been occurring have not gone exactly the way that we as a region would like. And the EMS Advisory Board, through their discussion, asked that the company come and give a presentation themselves to the board to say, what are our issues? Why is this timeline going so long? And so that request is being scheduled right now by City of Reno IT Director Kim G. There's a conference call that they have tomorrow, so they'll talk about that and hopefully get some dates. But the project continued to push out, which Director Kim G and Director Hines from REMSA made clear was not something that was acceptable. I sat in on that conference call also and used strong language on your behalf of how we are not appreciative of what's happening, and we needed some definitive dates because the can just keeps being kicked. And so hopefully we'll have some answers soon and come back with some concrete plans. As it stands right now, January 2020 appears to be the soonest that it will be implemented. So with that, I'm available to answer questions on anything else or on that topic.
Questions? Good. Thank you very much
You're
for the update. Very good. Mr. Dow, your turn. Emergency Medical Services Authority.
Good afternoon, Chairman and the Board. My name is Dean Dow, for the record, President and CEO of REMSA and CareFlight. You have the monthly report in front of you for your review, and I'm here to answer any questions.
Any questions? Okay, seeing none.
Make a motion to accept the report.
First?
Second.
Second? Okay. Mr. Delgado, second. All in favor?
Aye.
Opposed? Thank you,
Thank you
sir.
very much.
I saw you brought reinforcements, so.
Good afternoon, Alexia Jobson, Public Affairs Manager for REMSA, for the record. You have for your review the Public Relations Report for July, and today I'll give you an update about some of our more recent activities. Through the ongoing and successful partnership that REMSA has with Washoe County's Academy of Arts, Careers, and Technology, our Education and Public Affairs departments were able to reinforce the importance of early technical career opportunities, particularly in the EMS industry, when we welcomed 30 career and technical educators from across the state who were in town for a conference. Also, REMSA continues to work with Reno Dad's Blog on a series of submissions this summer, highlighting ways for dads to keep children safe during fun summer activities. The second blog post of the series featured dad and EMS manager at REMSA, Todd Kerfoot. His post highlights being prepared for emergencies while camping. The post outlines first aid kits, the ABCs, airway, breathing, and circulation of an emergency, and how to control life-threatening bleeding. You can check out the series at renodadsblog.com. Earlier this month, EMS Supervisor Ryan Ramsdale was interviewed for a story on KTVN about pedestrian safety, particularly during the back-to-school season. And finally, REMSA's Education Department received some great coverage from Fox Reno. They featured in-depth live interviews with Alma Marin, REMSA's Public Education Coordinator, and highlighted CPR certification, the importance of learning how to provide high-quality CPR, and how businesses can work with REMSA to arrange CPR trainings for employees. I'm available to answer any questions you might have about our public relations report.
Questions? Comments? If not, thank you very much.
Thank you.
Okay. Item number 11 is the review and discussion possible adoption of the business impact statement regarding the District Board of Health regulations governing air quality management. Mr. Inouye.
Great, thank you. Good afternoon, members of the board and Mr. Chair. For the record, Daniel Inouye, Acting Director for Air Quality Management Division. Earlier this year, your board directed Air Quality Management to review our open fire regulation. We've been doing that, and Ms. Julie Hunter has been assigned as the project manager for this. You may recognize her as the smoke management coordinator for our smoke management program. Julie has extensive experience with smoke, with fire, and air quality planning as it relates to fire. So with that, I'll introduce Ms. Julie Hunter.
Good afternoon, Mr. Chair, members of the board. For the record, Julie Hunter, Senior Air Quality Specialist with Air Quality Management Division. In summary, the current open fire regulation prohibits open burning throughout Washoe County from November through February. On March 1st, open burning is allowed throughout Washoe County with specific exemptions within the Truckee Meadows Hydrographic Basin, also referred to as HA87, which is what you are seeing on the display right now. The blue shaded area indicates the boundaries of HA87. So those specific exemptions currently for HA87 to allow for open burning are divisions of local municipalities, divisions of state or federal government, operators of agriculture facilities greater than 2 acres in size, operators of ditch and water delivery facilities, and the owner of any property where the fire control agency and the air quality officer jointly determine, based on an on-site inspection, that a public safety hazard exists and no other reasonable alternative exists for eliminating that hazard. So the Air Quality Management Division held meetings with the 4 fire protection districts as well as our enforcement branch to develop this regulation revision. The proposed open burning regulation will allow for open burning throughout Washoe County year-round, also with exemptions which are more flexible. And those proposed exemptions are on properties 2 acres of size or greater, divisions of state or federal government, divisions of local municipalities, canal and irrigation ditches, and again, the on-site inspection with the fire control agency and the air quality district. 3 public workshops were held, 1 in June and 2 in July, with Air Quality Management Division and the Truckee Meadows Fire Protection District. We received public comment from 4 individuals. A summary of those comments that we received are listed under item 1 in the business impact statement. So there are no fees from Air Quality Management proposed at this time. If there are public safety hazard inspections, if those are requested and conducted, the Air Quality Management Division will evaluate the burden, and if necessary, will propose fees to recover the expenses at that time. Staff recommends that the District Board of Health approve and adopt the business impact statement and set a public hearing for the possible adoption of the regulation revision. And with that, I'll take any questions.
Questions? Comments? Okay. Thank you very much. Presentation. We do have one public comment from Chief Moore.
Good afternoon, Mr. Chairman and members of the board. Oops. Excuse me. For the record, I'm Charlie Moore, Fire Chief for Truckee Meadows Fire. I'm here to support this revision of the regulations. I want to compliment your staff for the good work that they did. Julie and Daniel worked very hard on this, and we're very appreciative for their efforts. It's always been counterintuitive that we could not encourage people to create defensible space in the winter when the fire risk was the lowest. These regulations serve to align the goals of the health district and the fire district together. So I wholeheartedly would urge you to support this. Thank you.
Thank you. Any other public comment? Hearing none, I will take a motion on the business impact statement.
Hey, I just want to say something as well. We actually, I'm supportive of this as well, and I'll make a motion in a moment on that. We've had some of our own residents that will benefit from this, from the sense of, I mean, if they can't do this, then even the cost to them is skyrocketing to be able to do it another way. And so I'm very appreciative, and I think it's wise for us to do the best we can and still monitor. So I think it's a good balance of the two. So I'll make a motion to support this.
Okay, thank you. Second? Okay. Any other comments? If not, all in favor?
Aye.
Opposed? Hearing none, passed. Great.
Mr. Chair? Excuse me, if I may, there's also a second component to that, to schedule the public hearing for adoption of the resolution at the, I believe it's the next September 26th meeting.
Okay, good. Well, I was going to do it on resolutions, but good. We'll put that on the agenda for the September meeting.
It needs to be. It should be part of the motion for this
Okay.
item.
So
please.
I'll go ahead and add,
Motion?
I'll amend the motion to add that in there.
Okay, second. All in favor again?
Aye.
Opposed? Agendized, passed, we're all good. Thank you very much. Okay, moving right along to number 12. Ms. Albee, CBT as a food additive, and this is just a presentation.
Thank you, Mr. Chair, members of the board. For the record, Charlene Albee, I'm the Division Director for Environmental Health Services. The presentation for you today was prepared at the request of the board at the last meeting. There is a tremendous amount of information being circulated, not only in our community, but nationwide. So really the purpose of this is to hopefully give you some background information so that you'll be able to see where it's coming from and hopefully clear up some of the myths that are circulating. So the big question is, what is CBD? There are actually 113 identified cannabinoid isolates in the cannabis plant. It's a very complex plant when you get down into the biology of it. The most common one we hear about is THC and CBD. THC comes from the marijuana plant. So will step back and say the hemp plant and the marijuana plant are both part of the cannabis family. So THC comes from the marijuana plant, and that's what gives you the high. That's the attraction to the marijuana. Industry is looking to satisfy and serve the need or the desire. CBD comes from the hemp plant. The difference between the two, and this is part of the regulations, is that the CBD contains less than 0.3% THC. That by law is what separates one from being regulated through the marijuana laws and dispensaries, and the other one being regulated outside of that federal classification. So THC is what puts marijuana into the Schedule I drug by DEA. That definition is recognizing that the THC causes a change in the body. There's a reaction, that's the high. It actually affects your well-being, I don't want to say well-being, but it gets into the medical, that's where you get the feelings of the psychoactive from the drug. CBD was declassified by the 2018 Farm Bill. The hemp and hemp-derived products are now legal in all 50 states. Nevada is not an exception. We do have it legalized here. The last part of the Farm Bill actually identifies that it does not affect or modify the FDA or Public Health Service regulations. So the FDA regulations is really where we're at today to discuss how those are impacting. So with the hemp bill and the products that are coming out of now the growing of hemp in the United States, the approved substances are those that are topical. So oils, lotions, creams, lip balms. USDA is the one that's regulating the production. That's the growing of the hemp and the products. And FDA, through the Food, Drug, and Cosmetics Act, approves the use of CBD in the lotions. The unapproved items are food additives and supplements that have medical claims. FDA will not approve a substance until they have finished their research on it. And so at this point in time, that has not been completed. A lot of this is because it has been a Schedule I drug to this point. Researchers cannot work on Schedule I drugs because they're illegal. When you work on those, you risk losing your federal grants. And so there's really not a lot of research that's been done. There's a lot going on now because they're trying to catch up, but they really are behind the curve because of the legal restrictions. So the current CBD regulatory status is USDA, as I said, regulates the cultivation and production. Through the research and putting this together, I thought it was interesting to see that in Nevada, per the Department of Agriculture, we have 207 hemp growers, 53 licensed certified handlers, and 37 seed producers are now registered just in the state of Nevada. As you can see, obviously, there is an interest in the financial opportunities of this new industry. And I have seen more literature on this than I have seen on any other topic. And that's not even just my perspective, that's the perspective of the people that are out there doing the research, trying to coordinate the associations, getting everything going. This is the hot topic in America right now. I keep stressing, it's not just us. So the FDA regulates food additives. CBD is not an approved additive at this point. The basis that's really holding this up, whether they could say yes or no, is that the very first approval was as a drug for epilepsy, as a treatment for epileptic seizures. And I'm sure there's somebody with a medical background that can say that name, Epidiolex? There you go. See, I'm so glad you came because there's a lot of even worse words that we're gonna bump into. I'll apologize now that my engineering brain looks at these and goes, oh. So I try not to vapor lock, so. Recognizing that they have not approved CBD as an additive, the FDA has actually started issuing warning letters to major manufacturers of products that are being shipped across the country. So when it started going interstate, that's when FDA started getting involved, and there's a number of those businesses right there that the FDA has identified as who they've given the letters to. I can tell you that at least 3 of those came out of the Los Angeles office of FDA. So we have heard a lot that, you know, it's legal in all these states and everybody's doing it out in these states. Some states have approved it. Denver has adopted their own regulations, but it's just for the city of Denver. And the state of Oregon has adopted some regulations, but it's only for products that are manufactured and distributed in those states, in that state or in those cities. So we're kind of at that point where we look at what we have, where we're at, what the regulations say. I will add that the FDA has approved the use of hemp seed oil, powders, and proteins as food additives, and that's something that has not been challenged. The quantity of CBD in that portion of the plant is minimal to negligible. Those are really not the items that provide the CBD concentrations that make them classified as something that you would advertise as a CBD product. So what have we been doing here at the Health District? January 2019, a statewide conference call was held between Washoe County Health District, Southern Nevada Health District, Carson City Health District, which also covers Douglas County. They have an interlocal agreement, State Health, and Department of Agriculture. There was an agreement amongst all of the stakeholders at that meeting that we needed to be consistent and we needed to make sure that we were applying and interpreting the regulations across the state so that there wasn't an artificial advantage in one area over another. So when this started coming to our attention through complaints and people reporting that they'd seen CBD products out in, retail markets, the first thing that happened was prior to us taking any action, we actually did staff contacted the state health just to make sure, hey, we're all still on the same page, right? There's nothing that we've missed out on, that we didn't want to be putting pressure on Washoe County businesses if out in Carson or Elko or Fernley or wherever that they weren't doing the same thing. So at that point in time is when the actions started being taken around town. It's been all over the news, it's been all over the media. When we do find the product, we inform the merchant of the product not being legal. It does need to be pulled from the shelves. It does need to be not provided for sale. We have taken many actions around town where we have found these things. We have tried to put out as much information as we could. We used our social media. We sent out emails through our listserv. We've sent out postcards. We've tried to get the information out there. I can tell you that in July, we had a follow-up phone conference with everybody because all the other health districts had seen how much we'd been in the news. And so they wanted to talk to us and were actually asking us about how we were pursuing these and how we were taking our actions and organizing and logistics and stuff. And since that phone call, I can tell you that it's really opened up a chain of communications between all of our brethren, I guess. So here's a summary of where things are at and what we've done. I can tell you to date, all routine and special event inspections now include on the checklist to look to see if there's a CBD additive in any of those approved, or any of those products that are being sold at the, either at the special events or, you know, the stores where they're doing, and restaurants where they're doing their regular inspections. I can tell you that Department of Taxation contacted us last week, and one of their employees was at a service station, I believe is what it was, mini market down in Carson City, and identified a CBD water, checked the label, and it was manufactured in Sparks, and we didn't know anything about it. So we got the information on, it was either Monday or Tuesday this week. Tony Macaluso, the supervisor, one of the supervisors in the food program, went out with the area inspector, went to the facility, and was very pleased to find that when they got out there that they had already pulled the product off, that they had already manufactured, had it in the back of the warehouse. There was 3 pallets of it, was already shrink wrapped, and they had their own sign on it that said, "Do not sell." They recognized it, they understood, they realized that they were a little ahead of the ball, and were very appreciative of us, you know, coming in and clarifying. They had really good conversation, and that's the way we're handling these. We'll just continue until we have different direction. So the 2019 legislative session did pass SB 209. And what this does is it provides the authority through the NRS for the Nevada Department of Health and Human Services to develop regulations for testing and labeling of any hemp commodity or product intended for human consumption. That includes CBD. So it does set forth in that section the development for testing protocols and procedures. They're looking for and targeting an effective date of July 1st of 2020. So with the state developing their own regulations, we still have the FDA doing their research, trying to come up with the plan on where do we go and what do we do. So FDA's first and foremost mission is for protection of health and safety. So toxicity in the liver is one of the things that they're starting to find in some of their research. So here's those big words that I may mess up again. They're finding that there are a number of drugs that, when taken in conjunction with CBD, actually fight over the same pathway into the liver. And through the process of those drugs fighting each other, they are creating some liver damage. Some of the ones that they've identified is warfarin, benzodiazepines, opioids, and alcohol. So when, before the FDA will approve anything to be used, they need to have the warning label of what not to mix your drugs together. One of the biggest issues is a cumulative exposure due to access to a broad range of consumer products. Just in the day options that you have, you get up in the morning, you take your shower, and then you put on your lotion. It's got CBD in it because it makes your joints feel good. And then you go have your coffee and you get your CBD in that because you like to get your CBD in your coffee. Then you go to lunch and you get your big bottle of water that's got CBD in it. You have your big bottle of water. Later on in the afternoon, you decide, I need a snack. I'm running down a little bit. So you go get a snack that's got CBD in it because you're all about the CBD. All of a sudden, you've got a compounded dosage of something in your system over the day. And the FDA has not been able to, because they just haven't had time, to determine what the safe dosage is for recommended daily allowance. So that's one of the things they're looking at. They're looking at the effects on special populations, as they call it. They classify that as the elderly, children, adolescents, pregnant, or lactating women. That's a pretty broad range of research that needs to be completed. And then the appropriate concentrations. Research has shown that there's anything from 100 to 1,100 milligrams in products that are provided, just because nobody knows exactly what the right dosage is. So at this point in time, EHS will continue to enforce the FDA regulations until amended. Those have been adopted by reference and are included in our regulations, and we will continue to follow our regulations until such time as the state comes up with their regulations and tells us to do otherwise. So before we get to questions, I will say that I have gotten to the point where I do a search every day of the news just to see what's going on, because this is the fastest moving topic that I personally have ever seen. And I can tell you that just yesterday, the state of Washington banned the commercial sale of food and beverages containing CBD, sticking close to the U.S. Food and Drug Administration policy. So it's swinging both ways. We have states that are developing their own regulations, and we have other states that have decided that it's a risk that they're not willing to take until there's a clearer direction from FDA. So that really is where we're at. So when you hear that there's differing opinions, absolutely. Our mission as servants to the community is to enforce the regulations that we have. And when we get new regulations, we'll change that. So at that, I will answer any questions you might have. And thank you for your patience while we got through the weeds.
Thank you very much. Yes, ma'am.
Thank you. Come on, Light, come on. Thank you very much. Excellent presentation, very, very good information. Thank you very much. I'm curious about a couple of things. So is Washoe County, are you doing inspections in every operations that sell like dispensaries that sell marijuana? And what about, so is it legal for them to sell it?
We don't have any jurisdiction over the dispensaries. That's all handled through the state. Department of Taxation has their own registered environmental health specialists that oversee all of that.
So if it's sold through a dispensary, the county doesn't get involved, they leave that to the state to handle?
Yes, ma'am.
Okay, so I guess are you removing every edible that has CBD in it? So for instance, if it's a prepackaged that's been shipped in across country, are you inspecting and removing those from the sites also?
Yes, we are. What we're doing is informing whoever owns the business that it's not legal to sell here. We're looking to see where it's manufactured at. As resources are available, we've contacted either the local health or the state health in that state to let them know this is going on, and then recommending that the business try to return the product so that they can get their money back and not have a.
So you're
loss
not
of income.
actually taking the product, you're,
We have not taken possession of any products at all, no.
so, I guess I don't, I mean, I really get what you're doing here, and I think it's really clear that, you know, you've got certainly some authority to follow through on this. What I'm having a hard time really grasping, I think, is clearly, if you are, you know, like the company that's putting it in the water, and they're manufacturing it here in the county, then all of those you're taking care of. But, I mean, I can go down to just about any place and buy, I mean, you can get it from the pharmacy and not even go into the pharmacy section. I can buy just about anything with CBD in it, anywhere, for internal consumption.
There's a number of the major chains that have now realized that they have products on their shelves that they shouldn't, that have not been FDA approved, and they've started pulling them. Walgreens is a big one that was in the news not too long ago, that they went through and sent the message to pull it all out. So I think that there was a lot of excitement about a new product coming out, and it's gotten out there. So now that the horses are out of the corral, we're trying to round them up to get back to where we need to be. And this is not just a challenge for us. I will say on just one extra piece on the, we are not taking possession of those products. We are just telling them that they can no longer sell them and they have to take it off their shelves. The Southern Nevada Health District, when they find products that are large enough to be disposed of, they want proof of disposal if they're finding a manufacturing facility. So it is really something that we're all trying to work the best that we can.
So when medical marijuana was approved in Nevada, when the marijuana laws went into place, there were 3 types of entities that were approved: a growth facility, a dispensary, and what I like to call a bakery, because it's a facility that actually puts marijuana into product. Again, I suspect that was more under the medical marijuana perspective, but it can't be prescribed by a doctor. So how does this whole process that's going on right now impact those facilities that were approved by the state and licensed by the state?
They are operating under state law, and with the DEA and the federal Justice Department, they made a comment early on that they would not take enforcement actions in states that had strictly regulated the distribution. And as long as the state can demonstrate that they are strictly regulating, which I think the state of Nevada has done an excellent job, that we learned from the other states that went before us. And so we were able to put that all together, that we've demonstrated that we are strictly regulating it. So DEA is not, and the Attorney General are not looking to take actions here. That does not mean that if a change in administration happens, they won't come in. They can't come in and just do it. And that's a business risk that's out there, and I believe people are aware of that. And if the CBD state laws come along, then we will enforce the CBD state laws, knowing that FDA could potentially come in and take some actions.
Thank you. I appreciate your straight answers to the questions. For the record, I would just say I don't support recreational marijuana. I am a strong proponent of medical marijuana. I think that it really provides some medical benefits. I do not support recreational, didn't vote for it, and have made it clear on a number of occasions that I don't support it. So I guess what my concern is only that we are following exact rules with everybody. I don't want to end up getting the county sued because we stopped this person from producing and selling, and we didn't stop this person. And that's a realistic problem that's happening in a number of areas, and I feel I have a fiduciary responsibility to this county to make sure that we don't do that here. And so that's really where all my questions are coming from, and I appreciate everything you're doing. You are extremely knowledgeable. I know way more about marijuana than I ever wanted to know, and you know way more than me, so you're very knowledgeable on this, and I appreciate that, and I appreciate the straight questions. But I promise you, I'm not going to go away. I will continue to ask questions, because this is an issue that I think is gravely concerning to this county.
I will say that we have several thousand permitted facilities here in town, and then with the temporary food vendors coming in and out, we have limited number of resources. We've reached out the best we can, and we will continue. Once we get through a full year, every single one of our facilities will have been contacted.
There are so many things where we need more compliance officers. This just happens to be one of them.
Yes,
Thank
ma'am.
you.
Yeah. Councilman Dare.
Yes, it is a strange conversation because we move so quickly and forward and decide what we're going to do, and then on this one, we have the FDA in there. So I will also agree that certain things I'm not a proponent for. And so, but at the same time, I think we need to continue to obviously regulate what the law is. And so thank you for upholding that. That's our job, and we have no intention of doing anything separate. We heard words last month regarding words like targeting and things of that fashion, which I know we're not doing that, but we also need to make sure it's really clear we're not doing that. We need to make sure that we have a process by which we do that. Might just protect people from feeling that, because whether it's true or not, which I don't believe it's true, if that's how they feel, that's obviously not how we want them to feel. But the other thing I would say is that the one thing, it would be nice for us to get some updates as you get them of what is the road to this. I mean, when I say this, hemp and the CBD and stuff like that, for me, I don't like recreational use of drugs. That's not a key for me. I'm not excited about that. But people using oils and things like that, it's just funny how it just happens to be this thing and it's tied to this, so it gets more complicated. But how do we move forward? You know, there's obviously businesses that want to do that. At this point, it seems like it could be damaging. You mentioned a lot of liver issues and things like that, and our job is to protect. Even if there's a big wave of yay, it doesn't mean it's right. It doesn't mean it's good. But at the same time, it'd be good to really have good information and really communicate this to don't just us know it, but how do we help communicate this to our constituents, so when we have people say things like that, we have good information out there as well. And I don't know if that's part of our equation as well. Do we have anything where we're communicating the facts?
So at this point in time, we're communicating the facts, essentially what I gave you today. As far as the schedule moving forward, with the bill that was passed, they want to have regulations in place by July 1 of 2020. If you go backwards in the regulatory adoption process, considering the State Board of Health only meets every other month, and they have the same requirements we do for public notice, workshops, business impact statements, reg adoption, and you start going back from the state people, they realize that they really need to have something in hand that they can start getting out probably by January. We have expressed an interest in being part of that, so we can see what's coming and make sure that our concerns are in there. They're supposed to be looking at labeling, which is going to include warning labels and dosaging and testing, and how do you make sure it's a good, clean product versus something that was imported from Russia. We've heard things through the extraction process, which Commissioner Burke-Bigler was referring to, that the extraction process is very similar for CBD as it is for THC. There's the greener ways to do it using CO2. There's a lot of butane, isobutane that are used. We have heard that some facilities have actually, in non-regulated areas, have reverted to using things like methylene chloride, which is a really great thing if you're stripping paint off a car. So there's a wide variety of testing that it's not only the pesticides that the plants could have been exposed to, but regulating and testing for what chemicals are used during that extraction process, so.
Chair, I just have one more question on that. So we, just to say on the record for clear and at least our goal, maybe we're not fully there yet, but whether it's manufactured here or somewhere else, we do not sell CBD things in our region
Not for consumption.
for consumption. If they decide to consume it, we can't stop people from doing whatever crazy thing they want to do with whatever they want to do. But according to what we license, nobody across the board manufactured in Canada or New York or wherever said yes, we do not do that.
It is not an approved FDA additive for consumption.
Thank you.
Mr. McCollum.
Yeah, thank you, Chairman. Along those lines, aside if you're a dispensary, correct? If you're a dispensary, you can sell.
Within Washoe County Environmental Health jurisdiction, yes. We have
Okay.
no jurisdiction in the dispensaries.
So you can still go get CBD at dispensaries, but not anywhere else, is what we're saying here, for clarity.
Well, question for
For
that.
consumption.
For consumption, correct, and that's what we're talking about here. Just, again, that word gets foggy. But to your point, Councilman, is you can still go get CBD at approved dispensaries, because we don't have jurisdiction there, here in Washoe County. Anywhere else, you cannot. Is that true? Is that correct?
Yes, we are ensuring that it is not being provided at any of the facilities that we regulate under FDA, their guidelines in
And the whole,
Washoe County.
and the possibility is that we will have clarity in terms of how we move forward in July of 2020,
Yes, sir.
in terms of how that can be possibly moved out of dispensaries under our regulations.
And I would expect when that decision comes along that I would appreciate this board's guidance on if we are going to follow those regulations or decide how we're going to combine the state approval and the FDA wherever they're at in that process.
That was my point, just for clarity, to your point, there needs to be that understanding in the community. So we're not also the mixed messaging when we're out there saying it's not approved or so forth. It's two different pieces.
Chair, can I ask a question on that?
Sure.
Just some clarification. So is it then, to my understanding then, so whoever on the health side is not talking to whoever's on the marijuana side, and they haven't agreed. So on this level, they're saying it's fine, no big deal, and it's on the health side. So they need to get together on the state side and come to some better common answers. Does that sound about right?
I'd like the health officer.
If I could maybe provide some additional clarification. Under state law, for recreational and medical marijuana, they have established a regulatory structure that covers the production and the manufacture of these products and makes it legal to do that and to sell them in a dispensary. So it's not just a matter that that's not our jurisdiction. It's a matter that it's legal under state law, and there's a whole regulatory program that's been put in place to cover those products being manufactured. Whereas when you get outside of that chain of supply to a dispensary, we don't have any regulatory structure for that, and it's not legal at this point. So,
Thank you, that's clarification.
thanks.
Okay.
But
I'm sorry.
I was going to say, but that in and of itself presents the dilemma that we're dealing with from the public, is that I can walk into the dispensary and purchase it, but I can't walk into the candy store and purchase it. And that's the dilemma that we're dealing with here for the public, because the public doesn't understand why. I mean, you know, we like to think the public gets all of our crazy laws, but the truth is most of them don't. And the public doesn't understand why you can buy it from the candy store or the water store or the coffee shop, but you can go to the dispensary and buy the exact same identical product. And I think that presents the dilemma that we're dealing with here on the health board. So I think that's something we're going to have to worry
If I could add a little
about.
bit of clarification there, the products that are provided for sale in a dispensary have been manufactured under the oversight of the Department of Taxation and those state rules. So it's not like a company that bottles CBD water just and sells it can go sell it at the dispensary. They cannot. They have to be registered with Department of Taxation as a licensed facility to be able to produce that product under their overview and then sell it.
Yes, and I understand that. I understand that. My point I'm making is the public doesn't understand that.
Exactly. we are trying, we are reaching out the best we can and trying to get the message out there.
Mr. Young.
I just, for a little clarification here too, Marcia had mentioned that possibly someone could walk into a, some store that sells water or whatever and things there too, and it would be not compliant to the health department for them to be able to purchase one of these products. However, you mentioned that you could do that. I mean, are these products out there now on the shelves that I even looked for them? Okay, so I could probably go in this afternoon and find one, even though that is not compliant.
I'm trying really hard to not put out all of the names of all the places that we've been to. And we got a new one yesterday evening.
Okay.
We are receiving pictures from people that say, hey, I saw this on the shelf. And then we immediately send an inspector out and we get it pulled off the shelf and make sure that the operator understands. At least now we're able to say, did you get the postcard? Because it explained it all. So as they go about their routine inspections, they're looking at it through that point, and then we're also responding to the complaints. And like I say, once we get through the first year of cycle, because everybody gets inspected every year, some places are twice, some are only once, everybody will have been inspected, and hopefully we will have it off. If they continue to bring it in after they've already been instructed not to, then that'll open up a different conversation.
Okay, so therefore, it is not our policy to, be able to find these products. However, in reality, we can now. So that the next question comes if indeed the possible reason for this is the fact that we have an out-of-country or out-of-state manufacturer and we don't know the purity. If indeed we trust Nevada manufacturers CBD oil, is that, I guess from the public standpoint, that seems like a little bit of a dilemma why we can't necessarily allow a Nevada manufacturer who's using certified CBD to produce a product outside the dispensaries. But I'm just pointing that out as a bit of an inconsistency too.
I understand we're following the FDA guidelines, and that's what we have to work with.
Sure, I get it.
If I could follow up on that though, Mr. Young, the only manufacturers that we would have any basis for trusting would be ones that are regulated by taxation for that supply chain that ends up at the dispensary. If it's a product that's being sold through a store, that manufacturer doesn't have any oversight applied to it as far as how that product is produced and whether it's safe or not. So it's not every manufacturer in Nevada that we would have that program. That's why we're waiting for the state to come out with their regulatory program to cover this.
No, I get it. It's kind of a tough thing. It's still, I don't know if it's still all the rage or not too, but from the public standpoint, it's a dilemma too. I can see that, and I certainly want to make sure that this board maintains public health standards as high as we can.
And we appreciate your support.
Okay, I do have a comment since I came back from NALBO for the national meeting, and this is just a huge topic from all the health boards, health officers, state law, everything else. There is not even a consensus. The one thing I can tell you that was told us by the government is they are trying to move this all of marijuana and CBD under a class 2 drug so we can start researching it. And it's really strange. We've got everything in category 1 we don't know things about. There is nothing in the medical literature not a whole lot about whether the stuff is even effective before we start selling it, but it is the craze. It's in water, it's in everything, and like, Ms. Albee pointed out, there is no regulations on how it's done. They found some actually poisonous extraction material. There's a whole lot more carcinogenic than anything you're going to ever get in CBD. It is all over the board. And I think the one thing that came out that was positive is if they can change the category 2 so it can really start to be researched. Because it comes down to, as the FDA right now, and I understand it, anything with CBD as an additive, as a consumable, is illegal. You can rub it on anything, you can do it, but anything edible is really against FDA. And the thing is, they're finding more and more reasons not to approve it. but it goes way back to something they did when they declared it as a drug. So they've gonna have to work through their own thing to get it undeclared as a drug and then start working on it. So guys, we're not gonna see a real good answer to this for probably another couple years. And every state, every health department is in the same dilemma we are. And yes, the public probably has no clue of what's going on. I read about it in my magazine at home or in the bus station. Go back and buy it, it's wonderful. Well, we don't know one way or the other. So thank you for a lot of work that probably doesn't have an end yet.
No, I don't believe this will be our last conversation.
No. Very good. Okay, thank you very much. Okay, now we have a presentation on annual progress of our strategic plan. Ms. Katrina.
Good afternoon. For the record, I'm Katrina Peters, Director of Programs and Projects. I'm probably not as exciting as CBD, but I do have some exciting successes to share with you this afternoon. All right. So just as a quick refresher, we've got our vision statement, which is a healthy community. We have a strategic direction that we've outlined for ourselves, which is leaders in a unified community, making measurable improvements in the health of its people and environment. Our mission statement that guides us is to protect and enhance the well-being and quality of life for all in Washoe County. And we've got 3 value statements around trustworthiness, professionalism, and partnership and collaboration. We have a lot of exciting accomplishments to give you some quick highlights on today. My presentation today covers our progress in FY19. So in February, I gave you kind of a 6-month update, and I'm back here today to kind of share with you the recap of everything we've accomplished in fiscal year 19. So that's from July 1 of 2018 to June 30th of 2019. Out of our 143 items, 132 of those are either achieved or on target. And when I came for the 6-month update, there was a request to give a little more information on items that weren't achieved, and so I've got those at the end of today's presentation. We'll talk in a little more detail. But overall, really, we've done a lot of great work and have a lot of success to celebrate. To share some highlights from our first priority, and that's healthy lives. Our goal there is to improve the health of our community by empowering individuals to live healthier lives. We've got 35 items within this priority. 32 of those were either on track or achieved. In our CCHS group, with their Wolfpack Coaches Challenge program, they surpassed their target of being in 50 classrooms. They implemented the program in 63 classrooms. 35 of those were in Title I, which is really exciting to be able to get that program to those high needs audiences. We've also done some great work to develop some healthy vending guidelines. This was an item under our Community Health Improvement Plan, Nutrition and Physical Activity focus area, working in collaboration with CCHS and some other stakeholders. That group has carved out some guidelines on what we're going to consider healthy vending. We've also printed up some materials and some clings to put on vending machines to help guide folks towards that healthier choice. We also made some great progress in expanding smoke and vape-free park policies. We got some signage printed up and installed. You may have seen some media around that last week. A lot of great success also with our outreach events. So our CCHS group went out to over 260 outreach events across the community, which I think really speaks to how much work we've done to try to get out and provide our services to the community. We're providing vaccines and other services. We also were able to get an enrollment assistant here on site in the spring, and that's someone who can help enroll folks in Medicaid and other assistance programs. There's also a really successful tobacco prevention social media campaign. It got over 8 million impressions, and it also resulted in over 8,000 people coming to our website to get more information on tobacco prevention, which is exciting. Finally, within this priority, I wanted to highlight a new partnership we've developed with the Washoe County Sheriff's Office. We've got staff that are going out to the jail to share with women who are incarcerated on what services are provided. That's resulted in 75 women who were formerly incarcerated coming on site to get those services. So a new partnership, but really excited to be able to extend those services to women who need that. All right, our priority 2 is around a healthy environment, and our goal is to create a healthier environment that allows people to safely enjoy everything Washoe County has to offer. 19 out of our 26 items are on track or achieved. A couple of our highlights here, we had 95% of all days that were considered to be of healthy air quality. It's actually a little below our target, but we think that's likely due to wildfire smoke. Also, the installation progress has continued to get an air quality monitoring station at Libby Booth Elementary School. Our ozone standard was just a little bit above our goal. And that is being addressed through developing an exceptional events package. And again, that's due to that wildfire smoke, so we hope to get some accommodations around that. Our recycling rates in our area, unfortunately, are down. Our goal is 35%. We came in at 30%. What we think is probably going on there is due to that economic growth, construction generates a lot of trash, and also some changes in the markets around recyclable commodities and kind of viable markets for that. But staff is participating in a Green Biz program to try to help evaluate businesses for green practices. Our priority 3 around a local culture of health, and our goal there is to lead a transformation in our community's awareness, understanding, and appreciation of health, resulting in direct action. 23 out of those 27 items were on track or achieved. Some of our key successes there, we had several legislative wins. 4 out of our 5 priority areas we were successful in. We also were able to hire our government affairs liaison, Joelle Gutman, who was really actively engaged in the legislative session, and we had a lot of great wins there. We also continue to really draw a lot of folks to our website. So when we look at our weekly unique visitors, our peak was in August. We had 42,000 unique people come to the Health District webpage for information, which I think really speaks to our perception of being a good authority and a good place to get the correct and timely information. We also have continued to do a lot of extensive media coverage and social media campaigns. In our fiscal year, we had over 1,800 media interviews, press releases, and social media postings. So we kept busy with that. Priority 4 is around impactful partnerships, and our goal is to extend our impact by leveraging partnerships to make meaningful progress on health issues. 16 out of our 17 items in this priority were achieved. Some of our key highlights there is that we saw an average duration of our GI outbreaks in schools reduce significantly. So this past school year, it was down to 13 days on average, which is way below our target of 40 days. We've seen years in the past where it got as high as 60 days. So not only is that a big health win, but it's also an education win that we have kids in school instead of out of school sick. We also provided funding this last school year for the Signs of Suicide program. This program is a partnership between the school district and Children's Cabinet that provides the staff that implements the program. We were able to provide that suicide prevention education to over 5,000 seventh graders. Of those 5,000 kids, 12,000 received the screening. We need a parent permission slip to do that screening, so that's why there's a difference between the two numbers. Of those 1,200 kids that we screened, 30% were positive for being high risk for suicide or depression, which I think really says a lot about the significant need for this program. We've also had great partners come around the table to help us implement our community health improvement plan. It's a 3-year plan. We're 1.5 years into it. We've accomplished 77% of that entire plan, which I think is really exciting and I think really speaks to the partnership we've had in being able to implement that. It's challenging to get the community to agree what we're going to work on, and even more challenging to actually implement what we worked on. So we're really excited about that. Our 5th priority is financial stability, and our goal is to enable the health district to make long-term commitments in areas that will positively impact the community's health by growing reliable sources of income. This is one of our shortest priorities. We just have 7 items. 6 of them were on track. Some of our highlights there, that we continue to engage the state in conversations around increasing our funding. We did surpass our budget per capita goal. We're at a little over $55 per capita. Our goal was just right under 50. Priority 6 is around organizational capacity, and our goal is to strengthen our workforce and increase operational capacity to support our growing population. 36 out of our 38 items are on track or achieved. We've surpassed our target in terms of the percentage of performance reviews that we've completed on time across the health district. We also completed our workforce development survey in collaboration with UNR's Public Health Training Center. And this year, we really expanded the trainings we offered to staff, and we selected topics based on the data we were able to collect through our employee engagement survey. And this year, we also did a customer satisfaction survey. We got some good information from that, and that helped shape up what trainings to offer. We also were able to complete our accreditation submission slightly ahead of time. We also completed our site visit at the end of June. We received our site visit report, but don't have our final determination, so we look forward to getting that. Just to kind of talk through the items that were not achieved or on target. So our first item that's under priority 1, we did not quite meet our Healthy People 2020 goal for immunization rates. That goal is 80%. We've seen kind of some slight declines in that. The last data we have on that from April of 2019 shows us at about 75%. So we're a little below that goal. The 3 items under priority 2 that aren't on target are all related to air quality. So the first is around that ozone concentration, and again, there's been an exceptional events demonstration package submitted to see if we can get some accommodations due to wildfire smoke. The work to expand the West Reno Air Monitoring Station is on hold, pending getting that monitoring station installed at Libby Booth Elementary. And then our air quality index was a little bit below, we were 3% below our goal there. Also, under priority 2, we didn't quite meet our recycling target. And again, we think that's likely due to a lot of our economic growth activity that's gone on, and also some changes in the markets for recyclable commodities. In priority 3, we did not quite meet our target for number of permits that were applied for online. That's been reported to be less than 1% of our total permits. Under priority 5, we put pause on trying to work with the county around general fund transfers to address COLAs given our current funding balance. And then under priority 6, we put pause on revising our quality improvement plan. We were waiting to see what kind of feedback we would get from our accreditation site visit report, and the feedback we got on that was really positive. So we did a slight revision, but from that site review, we didn't have anything identified that we needed to change and address in that plan. So that's why we put pause on that, but we're back on track. And with that, I'll take any questions.
Great job. Any questions? Yes, sir.
I just have a comment. I really like the way the county is tracking, these goals and things there too. And I keep taking notes from how that works and trying to apply it in my own business to make sure we have the accountability and, the good, the bad, and the ugly that comes through it and things there too. But thank you for doing a nice job, and thanks to all the county staff for participating.
I think it's always important to have goals and right in front of us, so very, very good. And and thank you for putting what we didn't achieve. That helps us look at ourselves and see what's going on, and some of them we can see exactly why. One of the things I want to encourage, I might be talking to us politicals on this one, but I don't think the recycling is going to shift until we really look at our contracts with our waste management, period. I think you can fight all you want, but until all of it makes sense around. Now, I say that when we come to that, I'm going to make sure we really look at that as the city of Sparks. I know we're a few years still out before we're going to look at it again, but I plan to, as soon as we get a chance, to dive into that contract, because I wasn't part of it last time, just to see, because they've done there's a lot of things there that work and don't work with that. So I think that's not talking bad about them or whatever, but the reality is recycling doesn't seem to be the high-end conversation, so.
That certainly is another, I think, point of discussion for another time too, because I think we could do a lot more, and it's a big challenge though.
Mm-hmm.
Sure, the only thing I'll add to that is they do that waste composition study, so that might also be a starting point of like, what data have we collected on what our waste does break down into, if you wanted that data.
So I would say as we get closer, when we get in it, we'll probably would love to be armed with really good information. And I'm sure they're supplying some of information themselves, but it'd be nice that we're all kind of on the same page, talking about the same thing with them, so it's not just one entity at that point, but we really are looking at it. I think our culture is a lot more closer to caring about some of this stuff than it ever has been. And so that's nice. That's a good, sometimes it just takes time for everybody to get on page. And so My wife made me start recycling a few years ago, and I am really good at it now, so I do it.
Rinse those
I'm good.
containers, yeah.
It's my wife's fault, but good job.
Sit at my house.
Good job, though.
Great, thank you.
Mr. Health Officer. Thank you, Mr. Chair. I just thank you, Board, for your comments. I wanted to acknowledge that, I think the Board has done a really good job of developing a strategic plan that's actionable, and we track it, obviously, and have made significant progress in implementing it, and that's progress in the targeted areas that the Board has selected for us to move the ball with the health district and with the community. I just wanted to also remind the Board that we do have a strategic planning retreat coming up in early November. And unfortunately, I left my cell phone charging in my office, or I could tell you the exact date. But I believe, Ms. Rod, the 7th of November, and we'll be running 8:30 in the morning to 1 in the afternoon, I believe, and with lunch provided, so you leave fueled for the afternoon. But that'll be our opportunity to revisit the strategic plan and refresh that and set our fresh path forward. So, thanks. Any other comments? I'll entertain a motion to accept the report.
I move to approve the report.
Second, good. All in favor?
Aye.
Opposed? None. One comment I have, and that's a personal comment. Katrina, thank you. She has been assigned some of the biggest darn things we've had to do. She was really in charge and pushed all accreditation, and we're getting close to a resolve and a decision there. But man, this is just a tremendous amount of work to stay on top of. So thank you very much from all of us. Go ahead. Okay. Next item. Ms. Guthrie. We're going to talk about cost of living raises.
Good afternoon. This is Lori Griffey, the HR representative for the Health Department. We're here today to ask your approval to grant the district health officer the same cost of living increases that were approved by the Board of County Commissioners for the other unclassified management and several other associations and the employees within Marshall County. So if you have any questions, I'm happy to answer them.
Questions? Comments?
Make a motion to accept.
First?
Second.
Second? Good. All in favor?
Aye.
Thank you very much.
When did we start paying him? Darn.
Thank you all very much.
Okay, now, down to the good stuff. Staff reports and updates. Mr. Inouye.
Hey, good afternoon. Again, Daniel Inouye, Acting Director for Air Quality Management. Want to give you an update on our Reno 4 air monitoring station. We've got a lot of the underground work completed. We have the electrical out to the area within Libby Booth Playground ready to go. We have the fencing around there. We are finalizing some specs on the converted shipping container. We hope to have that ordered and start construction so we can have that delivered in fall and start collecting data in late fall. And with that, take any questions.
Been a long project. Any questions? Sure.
We had talked about the idea. I think I still just want to put out in front of you, it'd be good if we could, one, just in thanking that school for doing that, but if you had some grand opening that you know was going to be complete, it'd be really cool if we got some board members down there, made a big deal about it. The kids are there anyway. It's all around would be good for the health board. It'd be good for us thanking them as well, I think.
Absolutely. They have a new principal at that site, and we were starting to engage with that new principal and do that exactly to have lesson plans built around there. And we appreciate the assistance from City of Reno on that as well. But definitely it will be something to celebrate, and we'll coordinate that with our new communications manager.
Good. Thank you. Daniel, any questions? Good. Thank you.
Thank you.
Okay. Ms. Lottridge.
Just wanted to add to, it's National Immunization Awareness Month. I want to let you know that we did the Give Kids a Boost clinic on August 10th, and 142 kids were vaccinated and 435 doses of vaccine were given. And the clinic we're still seeing increase in clients on a daily basis with back to school. Had to increase the number of nurses we have on, and should be seeing that through the end of the month. And happy to answer any questions if you have it.
Good. Any question? Good. Thank you very much. Long time no see.
I know. Getting used to it almost. For the record, Charlene Albee, Division Director of Environmental Health Services. I wanted to just provide an update, the program update at the beginning of the staff report was addressing some of the issues that are going around Swan Lake. I wanted to let you know that the health officer and I attended a meeting right before this meeting of a stakeholders group that's been put together to start to look at where we are, where we're going, long-term solutions, with a real focus on making sure that everybody's on the same page and we're all providing the same information to the community. And it really is looking at accuracy of information and building that trust back again, and how we can do a better job to make sure we get the information out there. But it was attended by all the regional partners. The Army National Guard was there, the school district, all the county, the engineering from both Reno and Washoe County had city councilmen there. There was, the state was there, both the water pollution control and the emergency management group. It was a huge room, so I thought it was a very beneficial meeting for everybody to get on the same page. So as those proceed and things come up, we'll be more than happy to share. And with that, I'm available for any other questions.
Questions? Comments? Good. Thank you very much. Okay, Dr. Todd, you're on. He always has big words, too, that we can't pronounce.
Good afternoon again, Randall Todd for the record. In my written report, we talked about a suspect plague case. I'm happy to report that was ruled out. It's not plague. That's the good news. The bad news is it turned out to be hantavirus. Also good. However, the other good news is that particular case survived, but we have a second hantavirus case that did not survive, so that's sad news. And with that, I'd entertain any questions anybody may have.
Yes, sir.
I have a question on the hantavirus thing. So is there anything that do we just watch it and hope it just goes away? Is there anything that we're doing? What do we, or let people know? Is that something that spreads quickly? I mean, obviously, it comes through rats or mice or whatever, so that they spread quickly.
Yeah. So we've been attempting to educate the community about how to prevent hantavirus infections. The good news is it does not spread person to person, but it does come from rodents. And so if you have rodents in your home, getting rid of those is important, and there's some specific ways to do that. We recommend wet cleanup methods. Anything you do that stirs up dust, so if you see rodent droppings in your garage and you decide you're going to sweep those out, that creates dust. And if those were deer mouse droppings and the deer mice had hantavirus, then you're potentially breathing in infectious material. So there's a number of things like that, but we recommend that people wet these places down with a disinfectant solution first, and then avoid creating dust as they clean it up. Several years ago, we had done a lot of education throughout the state on how to prevent hantavirus. But it's interesting, we went through a number of years where there were no cases reported, and I think people gradually became complacent about that. And then the year before last, we had 2 cases in Washoe County, one of which was fatal. We managed not to have any last year, but now this year we have 2 cases again with 1 fatality.
Anything else? Yes, sir.
Thank you, Mr. Chairman. With conversations in the community, I'm reading more and more articles related to the national conversation related to the public charge rule. The public charge rule, maybe you can answer this, Mr. Kevin Dickwith, related. How are we setting ourselves up for conversations related to immunizations or so forth in the community as it relates to a lot of our demographics that may be impacted by this?
So, I think I'm on, okay. We have been working to communicate with people that are accessing our clinical health services that none of our services are covered by the public health charge. So that rule, basically the rule says that if you are a beneficiary of a government program that provides for support for you in some way, welfare, SNAP, or some of them, that can count against you if you're trying to receive citizenship here. And so our programs are currently not covered by the public charge rule, so we're trying to educate our clients regarding that. Further, the programs that are covered by the public charge rule, it's not retroactive. So if somebody accessed those services before the October 15th date that's established under the rule, that will not count against them in that citizenship process. And so we would expect if any of our programs are added in the future, it wouldn't be a retroactive something that would count against people that used them. That said, though, I have heard from our CCHS director that we do have people that have declined seeking assistance from programs we've referred them to, et cetera, because of their concerns over the public charge rule. So that program, I think, is detrimental to public health. It impacts not only people that aren't citizens that are here legally, that would be taking advantage of those programs, but also many of those individuals have family members who are U.S. citizens. And so based on that person's fear of how that public charge rule could work against them, we have people in our community that are not receiving benefits that they need, children that are being harmed by not having the benefit of those benefits that are U.S. citizens.
Yeah, just kind of add off of that. It's. I think all of us are aware of the issue, or if you're not, but it can multiply pretty quickly if we're not out there communicating as best as we can to notify them that we are government, but at the same time we may not be held to the same restrictions in terms of what is being pushed forward. And it's just that much more important for us as a public entity, especially public health, that we're reinforcing that into a lot of these communities. Again, to your point, Dr. Todd, is if people are sick and they're not seeking support, they're going to get more people sick to the detriment of everyone else in our community. And so that's why communication is essential, especially during these times of lack of trust with government. So thank you.
I'd like to respond to that. I am in a very interesting position with my being on the board of NALBO and the NHO people. We are talking directly to the government affairs. We've been on the phone and communications all of last week and into this week. At this point, NALBO and NHO are not going to make a public statement on it because there has been so many lawsuits filed already by state governments. There are several things gone into Congress and bills moved there to make sure that there is no public money, tax money being spent on any kind of enforcement efforts. There's a bunch happening. As for where we're making statements, the statements are done with exactly what you're doing. It's really a major detriment to all of public health, immunizations, TB, everything that we might be running against. And so we're sitting there ready to go, very much watching it on a day-to-day basis. But there seems to be, and there's another nonprofit entity that's really into immigration, has been watching this, has been working on this for quite a while. We've known about it. There's been some articles written 6-8 months ago, even in the NALBO materials about public charge. So yes, it could be a real detriment, but there's seems to be an awful lot of concrete work being done to stop it, so. That's it. Dr. Todd, do you want to say anything about some of the new vaping problems that they're seeing?
I hadn't planned to really talk about vaping because that's a little outside my programmatic area.
Okay. Well, let me say there's been a lot in the media. I don't know if you've seen it yet. It came about, my first hearing of this came about last Monday on the issue, a week ago Monday, because it was NALBO. There was 8 cases in the state of Wisconsin. At that time, all 8 are on respirators. And what they're finding out is there's a lot of moisture in your lungs to move materials back and forth. This dry material that's coming in, some of these vaping things now, is making like concrete on the inside of it. So it's something we need to just watch and be very aware of. It was up to 150 cases the other day, so just,
Mr. Chair, maybe that's a great topic for a future agenda item.
okay. I just watch it right now in media. There's a lot of stuff going on, so. Okay, very good, thank you. Okay, thank you. Mr. Dick.
Thank you, Mr. Chairman. A couple of things. I wanted to add some additional information for the board. I noted we had our Acela Regional Oversight Group meeting yesterday, and that was to discuss our payment processing on Acela, the regional platform that we have and that the health district uses for our permitting activities. And the discussion concluded with a recommendation that we join with, do a joinder under the City of Reno's contract that they established with Gray Quarter for implementation. Basically, they would be the host platform for our payment processor and connect them with the Acela system. We have been using a payment processor, OPC, it's called, but there were some difficulties with them, in particular City of Reno, having some difficulties with how that was working. And so with this decision to proceed with the Gray Quarter as our implementer, then they can set up the interface between Acela and the payment processor, NCR, to accept the credit card payments and e-check payments. And so that provides us with a path forward for continuing to be able to accept those payments through the platform. We had engaged in an RFP process that there were some difficulties with, as it turned out, but with the City of Reno's action on their contract, we can move forward with a joinder agreement is the recommendation there. And then we can also, in case that doesn't happen in the time frame for the end of the OPC contract, which is at the end of October, we have a safety net of being able to use PayPal on a month-to-month basis, and there's an existing interface that exists with that with Acela. So we'll proceed with moving forward to provide the continuity of that opportunity for our citizens and improve it is our goal. And then I also wanted to provide a few updates on the Truckee Meadows Healthy Communities. In my report, I noted that we're going to have presentations on the regional strategy for housing affordability provided at the Reno and Sparks City Council meetings and the Washoe County Commissioner meetings later in September. The Nevada League of Cities is meeting in Henderson the week of the 23rd. They're meeting on the 25th and 26th, I believe. So those city council meetings for Reno and Sparks are both being held on Monday, the 23rd, to accommodate their members being down for that meeting. I don't have the times yet for when those are scheduled, but there'll be two presentations, one to each of those bodies on Monday, the 23rd. And on Tuesday, the 24th, there'll be a presentation. These will be by enterprise community partners that worked on that strategy. That'll be provided to the Washoe County Commissioners on the 24th. And I would ask, if at all possible, I will put out the information, and if our non-elected or appointed members could attend one of those meetings to be able to get that presentation. This is, part of our community health improvement plan initiative to develop this regional strategy for housing affordability. And I've also requested that as the schedule's filled out for enterprise community partners, that there be an opportunity on Tuesday for board members to be able to have time to meet with them, or appointed members, if they have any questions or discussions that they want to have about the strategy. So I'll forward that information about those available time slots as they become available, and I'd really encourage you to get briefed up on that strategy. I think it's could be a very valuable resource for our community and a number of policy tools that can be used to increase both the construction of new affordable housing, the preservation of existing affordable housing, and providing the housing that we need as a community so that our workforce has the different types of housing choices and price ranges that they need, not just on the low-income affordable housing level, but across the range. And then I'd also like to mention that we are going to be holding a behavioral health forum on October 2nd. This is just coming together, where we'll have a number of presentations. We'll have a new regional behavioral health profile that we've developed, and presentations on activities. Senator Ratty will be speaking on what's happened in the legislature and our regional behavioral policy board. We'll have the sheriff talking about what he's been doing with the jail and recidivism reduction, our substance abuse task force. We'll have Amber Howell talking about the women and children's shelter, Kristen McNeil about behavioral health issues at the school district. So that's all happening October 2nd. We'll be right here at the Chambers, 8:30 to 11. I'll get information out, but I encourage you to try to attend that as well. And then lastly, I just wanted to mention it's Employee Appreciation Night at the ball game at the Aces tomorrow night on Friday. And several times the board has recognized Jackie Chaidez for the humongous amount of shining stars that she's received. So she has over 40 shining stars. That's the most of anybody in the county. And so she is going to be throwing out the opening pitch for the Aces game tomorrow night. So I just want to let the board know. Thank you.
Good. Next thing is 16 board comments, announcements, anything else? I do want to apologize to the board. I'm sorry, I kind of jumped off our agenda here with the vaping thing. I'd like to put that on to Dr. Todd to kind of look at for our next report. Also, one of the things that we're seeing a huge amount of in the country is hepatitis A. So if he can kind of give us a summary, but I'm sorry, I guess jumped the gun. It was a huge public health thing. It's just going boom. So apologize. NALBO, as you can tell, I went and wow, did I get an education this last week. And the biggest thing I walk away with, boy, do we have a heck of a health board. We are in areas done advanced more than even a lot of the big ones. And the big shining star thing that we do here that nobody is up to our pace that I found was our emergency preparedness. And 3 different times I mentioned in different meetings, go out, don't do just a paperwork tabletop exercise. Take your tents and stuff like that. You'll find a totally different thing, like we did when we did our last big exercise and put up all the tents out there. Found out nobody really knew how to set up the tents right away in a quick method, and your x-ray machine doesn't just automatically come off the curb. So that was things that we learned, and yes, they're expensive to do these, hands-on exercises, but people just sit there. We've never done anything like that. Well, I'm going to tell you from experience, yes, we do. And there is something coming up in November. Kind of watch it, what's going to happen. There may be another chance for somebody to join Mr. Dare and I and be in patients in November. So watch your calendars. So anybody else got something? If not, let's move to number 17, public comment. Will it air?
Hello, Will Adler, for the record, with Dorinda's Chocolates Day with Stillwater State Government Relations. I would just briefly like to say thank you to Washoe County Health and, working through this process that has been a long and a arduous road with CBD, all these different topics coming forward that, it's, you get informed about things. This is happening now. It's a complete crisis, and, everyone gets hit with the shiny things. And, we heard that today that, CBD has new health impacts and new effects that we're learning every day. Well, really, it's more just drug interactions, like any prescription drug goes through those trials. You have to know your drug interactions, what's dangerous, what's not. But having said that, Washoe County Health has been reasonable to work with, and we've been able to come to agreement that we're in a pause state right now. It's not Washoe County's health. It's not the state's fault. It's not local businesses' fault really. Federal government does need to update those regs. The Farm Bill has passed, and that does need to be addressed. Is that necessarily Washington County's health? No. And we are understanding that, and hopefully Washington County is too. So we'd like to say thank you for that. And that I do think state will have regulations out this year, if not actually, first quarter next year, we will have some sort of state regs. I mean, we're looking at July 1st, 2020, but this as well has accelerated their own timelines, their own thought processes on this, because this is important to everybody. And if you'll indulge me, I'll take off my Dorinda's hat and put on my Will Adler hat. I personally do activate for all sorts of lab transparency, testing, and safety in our marijuana atmosphere, because this is going on in every state. This is going on across the country. And this is why we passed Senate Bill 209 this year. I mean, I was one of the authors and participants in that bill because we do see massive CBD fraud, massive THC fraud across the spectrum for marijuana and cannabis products, because they're covered in pesticides, they're covered in herbicides, they're covered in mold, mildews, funguses when they're not tested properly. And that's something we do advocate for, is the clean testing of CBD products in the state of Nevada. And I think, Nevada will be at the leading edge of that again. We have the gold standard of marijuana. I think we'll get there with CBD, because we're going to require lab testing on not just is it CBD or is it properly labeled, but is it safe to take? Because legitimately people are taking this thinking it is, more than it is, I'll say that for the record, a cure-all, and can do a lot of things even for them or their children. So this is something that we do have to take seriously, and we do have to lab test, and we do have to, really appropriately handle. So I appreciate your caution on this and your thoughtfulness on this as well, from a Will Adler level as well, not just Dorinda's. But thank you very much. Great presentation. Almost nailed it, but they're the same plant. There's no two different plants, but other than that, pretty darn good. All right, thank you guys.
Thank you, Mr. Adler. I will entertain a motion for adjournment.
So moved.
Nobody going to second?
Second.
Oh, good, thanks. All in favor?
Aye.
Thank you. Okay, see you all next month.